Imagine this, a disease that affects millions every year, yet many people still don't know how to protect themselves or treat it properly. Tuberculosis, or TB, continues to be one of the top infectious killers globally, but it doesn't have to be that way. With the right steps, it's entirely preventable and treatable. In today's video, we're going to break down exactly what you need to do to keep yourself and your loved ones safe from this silent invader. Stick with us until the end, because these tips could be life-saving. Preventing tuberculosis starts with awareness. TB primarily spreads through the air when someone with active TB coughs, sneezes, or talks, releasing tiny droplets containing the bacteria. But here's the good news. You can take proactive steps to reduce your risk of infection. Let's look at some effective ways to prevent tuberculosis. Vaccination, BCG vaccine. The first line of defense is vaccination. Many countries use the Bacillus Calmette-Guerin BCG vaccine to protect against TB, particularly for children. This vaccine doesn't guarantee full immunity, but it offers protection against severe forms of the disease, especially in infants and young children. If you're in a country where TB is common, getting vaccinated could be a game changer. Avoid close contact with infected individuals. If someone close to you has active TB, it's crucial to reduce contact until they are no longer contagious. People with latent TB aren't a threat, but those with active TB need to avoid spreading the bacteria. Masks, proper ventilation, and keeping a safe distance can help. Improve ventilation. Since TB is airborne, well-ventilated spaces can make a huge difference. Ensuring your home, workplace, or school has proper airflow helps prevent the concentration of TB bacteria in the air. Opening windows and using fans to circulate air are simple but effective ways to reduce the spread of the bacteria. Healthy lifestyle choices. A strong immune system is your body's best defense. Eating a balanced diet, exercising regularly, and getting enough sleep can help your immune system fight off infections, including TB. Avoiding smoking and alcohol is another important step, as these habits can weaken your lungs and make you more susceptible to TB. Screening and early detection. In high-risk areas, regular TB screenings are recommended. If you've been exposed to TB or show any symptoms, get tested. The earlier TB is detected, the sooner it can be treated, reducing the chances of spreading it to others. Now, let's talk about what happens if you or someone you know tests positive for TB. Here's the thing. TB is treatable, but it requires discipline and patience. Treatment can take several months, but following it strictly can lead to a full recovery. There are two types of TB treatment to consider. People with latent TB don't feel sick and they're not contagious, but they can develop active TB later. That's why treatment is essential. Typically, doctors prescribe medications like isoniazid, rifampicin, or a combination of both. This treatment usually lasts for several months to ensure that all the bacteria in your body are killed. If you're diagnosed with active TB, you'll need a combination of antibiotics. The most common drugs used to treat active TB are isoniazid, rifampicin, ethambutol, pyrazinamide. These drugs are typically taken together over a period of 6 to 9 months. The key is consistency. Even if you start feeling better after a few weeks, it's critical to finish the entire course of antibiotics. Stopping treatment early can cause the bacteria to become resistant, making the disease much harder to treat. While most TB cases are treatable with standard antibiotics, there's a growing problem: drug-resistant TB. This happens when the TB bacteria no longer respond to the medications used to treat it. Multi-drug resistant TB, MDR-TB, is harder to treat and requires longer, more complex drug therapies. If left untreated, it can become a serious threat not only to the patient, but to the wider community. How can you prevent drug-resistant TB? By strictly following the prescribed treatment plan. If someone with TB stops taking their medication too soon or skips doses, the bacteria can adapt and become stronger. So, it's essential to finish every pill, every day, even when you start feeling better. The role of support systems in TB treatment. Treating TB isn't just about the medications. Support from family, friends, and healthcare workers plays a huge role in a patient's recovery. TB treatment can be long and difficult, and many patients face side effects from the medication like nausea, loss of appetite, or fatigue. This is why having a support system can make all the difference. Programs like DOT, Directly Observed Therapy, involve healthcare workers ensuring that patients take their medication regularly. This hands-on approach can significantly improve treatment outcomes and prevent drug resistance. Don't hesitate to seek help from your community health centers. They're there to support you throughout your journey. TB may be a serious disease, but with the right knowledge, it's entirely preventable and treatable. Whether through vaccination, early detection, or consistent treatment, we have the tools to protect ourselves and our communities. By staying informed and proactive, we can make TB a thing of the past. Thanks for watching. If you found this video helpful, give it a thumbs up, share it with your friends and family, and don't forget to subscribe to our channel for more health tips and insights. Let's spread awareness, not tuberculosis. Stay healthy and see you in the next video.